Months after contracting COVID-19, some survivors are telling doctors everything smells disgusting. They can't taste food correctly or they can't identify common scents.
So if you can't smell coffee, we would call that perhaps a loss of smell, especially if you're not smelling other items as well. And this has been a more common complaint that we're finding after patients that have had the COVID infection.
Minka Schofield, MD, who's an associate professor and ear, nose, and throat specialist at OSU Wexner Medical Center, says she's seeing a range of problems.
Most people that are coming in are actually complaining of a decreased sense of smell or loss of smell. That's what I'm seeing most commonly in my practice. The other problem that I'm finding is phantosmia, which is, why do I smell smoke? I'm smelling cigarette smoke constantly, or I'm smelling feces constantly and I know it's not there. I have one patient who complains of a garlic smell constantly, knowing that it's not there. So I would probably say those are the things that I'm seeing most often.
Unfortunately, treatment options are pretty limited for people who experience smell loss.
Oftentimes we will try steroid therapy, but there's really no consistent evidence that steroid therapy is effective, particularly in COVID infection. But it is worth trying, whether that's via a pill or a nasal spray. The one thing that we do recommend is olfactory training. And it's basically a technique where you're trying to remind your brain, for example, what does a lemon smell like, or what does coffee smell like while you're smelling the object. You're reminding yourself what it smells like to try to retrain the brain into recognizing the scent. The other thing that we're seeing in conjunction with smell loss is taste dysfunction. In order for you to appreciate the flavor of food, you have to be able to smell. And so when people are losing their sense of smell, they're also finding that they're losing their sense of taste.
If you've found your sense of smell has been lost, distorted, or altered following COVID-19, let your doctor know, particularly if it's causing you distress. For the digital team, this is Cynthia Rozzi on NBC4i.com.